evening and welcome to What's New. Tonight we have the hospital and Kathy with domestic violence. So the hospital is going to talk first and they're going to introduce themselves. So who wants to start?
Okay, I'll start. I'm Rodney Scher, and I'm the board chairman. Been on the board 40 years.
That's a long time.
Yep.
Steve Henson, I'm the hospital CEO.
And the newest person in the group.
And the
I
newest
think.
person in the group.
Yes.
Not new to healthcare, but new here.
Veronica Charlo, and I've been on the board. I'm the board secretary, and I've been on the board for nearly 15 years.
Or 15?
Yeah, 50. It'll be 15 in April.
Oh, good for you. Yeah.
My name is Herschel Parker. I'm the Executive Director of Quality and Risk Management. I've been with the organization for about 20 years.
Great. Long-time people on here.
Yeah.
Jennifer?
Yes, good evening. I'm Jennifer McBride-Hobbs. I'm the Chief Nursing Officer at the hospital, and I've been with the hospital since April of 2021.
We're very happy to have you here tonight. And we know how important a resource the hospital is for our community. And talk a little bit, you've been here longest, talk a little bit about the history of the hospital, because I think it's kind of unique.
Okay, I've got a few notes here so I don't miss anything. The first step was in 1964. The citizens of St. Genevieve wanted a hospital. So they proposed a bond issue, and they got a group together, and they went to the schools for one thing, and they asked the schools, the high school seniors, if they would write an essay about why the hospital is so important to the community. And believe it or not, Rita Broomfield, who was our director of nurses for many years, won that back in 1964. So they ran the campaign. It was May 5th, vote May 5th, Hospital Day. And so it passed. It had an 81% approval.
Wow.
And which was unbelievable. And the original bond issue was for $500,000. And then a couple years later, they went back for another bond issue. And I don't know the exact amount, but it was a lesser amount. But then the hospital, the construction started in 1967, and we April 9th of 1969, the hospital opened. So it's been quite a trip. We've had 3 additions to the hospital since it was originally opened, and just a beautiful facility.
It is. And it has a very good reputation in the community and outside the community, I think.
Yes.
And I think that it's attracted some very, very skilled and competent doctors.
Yeah.
And staff. And there are new people coming and going all the time. And the newest person on the hospital staff is here with us tonight, which we're happy to have you introduce him to our audience.
Okay. We have Mr. Steve Henson. Steve comes to us. We'll let him explain, give you background on where he's been. But the qualifications he brought to this job just couldn't have fit any better for what we need with rural health care, with, the issues that, that all small hospitals are having.
Yeah.
He has lived that and in other hospitals, and he has come here and he's going to do a tremendous job for us.
That's
Steve,
great.
I'll let you give him your...
I have one question before you
Yes, ma'am.
answer that. There are no plans at all to sell out to Mercy, right?
No.
No.
Yeah. Okay.
I will speak.
Several people have asked me that, so if they're listening, they'll know.
There are no plans other than for us to remain an independent county hospital.
Yes.
Good.
And I do not see anything in the future that will prevent that.
Oh, good.
Yeah.
All right. Continue.
Where were we? My background in healthcare began in 1988, working on ambulances, and in 1990 up until the beginning of 1994, I was a paramedic in Little Rock, Arkansas. Early on, I've worked in ERs. I've been responsible for managing ERs and ICUs. Been in healthcare the second half of my career. I went back to law school at night. I was working a full-time job, had a young family, excuse me, And I went to law school at night. I did not go to law school to hang out a shingle and practice law. I went to law school to do exactly what I do now. And the reason for that, in running a hospital, there are infinite number of contractual issues, whether it's supply contracts or employment contracts, that I thought a law school education would help with, and it certainly did. Once I finished law school, I stepped into administrative roles. This is my fourth hospital as a CEO during these years, and I have enjoyed every minute of it. I have gravitated, towards organizations that were in need of help, whether that help was on a cultural issue or whether that help was on some financial issues. And I looked at, when it came time for my next job, this one, I looked across the nation and I identified 3 hospitals I was interested in. This was one of those 3, and the rest is history. And here I am. And I intend to do some really great things for this organization and this community.
And you're brand new. You really have only been here a short time.
8 or 9 weeks now.
8 or 9
Yeah, I think
weeks.
June 23rd?
I believe, yeah.
June 20th.
Yeah,
June 23rd. So a little over 8 weeks.
yeah.
Yeah.
Some of the issues that the hospital is facing have to do with the fact that we have a growing population in the county. There's I think a real large amount of growth in the north part of the county. I'd love to see all those people utilizing our hospital, but a lot of them are going up to Festus. And are there some thoughts about how more people can be attracted to the really very good health services that we have in this community?
So certainly, I mean, obviously we have our facility at Bloomsdale there, but for future growth, one of the things I think we can do for the community to really help people stay here closer to home, I think we have a lot of opportunities, particularly in the outpatient surgery arena. We already have a good number of specialists here, but I think there's opportunity in the future for growth in that area by attracting more specialists who would be willing to come out of St. Louis here to do the procedures. It will allow you being the patients and the patient's family members, which is just as important, to stay here closer to home. So I do see that as a real viable opportunity for us in the very near future.
I'm going to turn to Veronica Charlo, whose husband is one of the main physicians who's been associated with this hospital for a very long time. She's the only woman on the hospital board. I specifically asked her to be here this evening because of that. And you've been on the board for like 14 years.
It'll be 15 years in April.
15 years in April. What do you see as the most urgent or important issue that the hospital is facing?
I really do think it's just staying independent. That, to us, that's the most important thing. And that's what we're working on. And every meeting we talk about that and what it's going to take for that to happen. And that's just a big issue for us. But we have a great medical staff. You know, we have a lot of things to offer. And if we can just get out there and people can come in and see what we have, they would be impressed. Because we have so many people that even come in from Perryville and they're like, we've never been in this hospital before. It's wonderful. And it's great to hear that. But I think people would, if they would just understand, we've got great medical professionals, we've got great staff, and I think that's the most important thing for us to market.
Yeah.
But it's a great hospital, and I'm happy to be associated with it. And so is my husband. I mean, we've been here 35 years. So like I've told you, this is home for us.
Yeah.
And he loves the hospital. He goes to work at 7 o'clock in the morning. He'll come home 5, 6 o'clock at night. And that's his life. That's what he does.
Yeah.
And I'm okay with that because I know what he feels in his heart. So St. Genevieve is very important to us.
Now, how large is the medical staff of the hospital nowadays?
So we are sending out re-credentialing packets. You have to re-credential the staff from year to year, and we're sending out 193 packets. So that's not all the physicians, obviously, that we employ and that are here every day. That includes the radiologist and all the specialists that come in. Some of them are here once a week. Some of them are here once every other week. Some of them are here, less than that. But 193.
What you may not have the specific number, but what kind of percentage are we looking at in terms of full-time physicians here in this community as opposed to the specialists who come in? Some of whom I know, and they're terrific.
Yeah.
You
As
know?
far as the percentage, I don't have that off the top of my head. I mean, our employed staff of physicians and advanced practice nurses, I mean, Herschel, would you think it's upwards of 40?
I was gonna say 40.
Yeah.
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 I enter in, and I apologize for not knowing off the top of my head. I interact with so many of the clinicians every day that I'm more concerned with who's telling me what at the moment rather than keeping a head count.
Okay.
But yeah, as far as employed clinicians, about 40
Yeah.
we employ, and the rest are again radiologists or surgeons that come, urologists and others.
Herschel, talk to us about your role.
But my role.
Uh-huh.
So my role, my primary role, I would say, is just taking care of people, taking care of the quality of the organization. Because at the end of the day, it starts and ends with people. Our mission statement is we put people first by providing excellent, personalized, and compassionate healthcare. And I think that everybody in this room from the hospital, whenever we show up for work, we recognize that that's our mission whenever we come to work. It's not about us, but it's about all the various patients that we have the privilege of taking care of in the community. So I would say that's my primary role, but also in that role, I have some responsibilities for some other various operational departments. Jennifer has all the nursing areas, and then I have the other ancillary departments like radiology and pharmacy, food, nutrition, housekeeping. I could go on for a few others there.
A whole bunch of others.
A whole bunch of others. But I think that one of the things that is a common characteristic, even amongst that 40% of those physicians who are within the community, just last week we had a group come in from the outside of the organization for a day, and they spent the day within the organization just learning about healthcare. And during that interaction, one of our providers, his name is Hunter Wadlow, he's one of the nurse practitioners over in Point Base. He came and he presented to that group of individuals just a little bit about what makes him tick. And a thread that he shared several times was primary care and just being able to see a patient and have a relationship with that patient and know that patient and recognize that he is able to manage all aspects of the care of that patient. So I think that's a common thread amongst that 40% of physicians, that they are truly within the community and wants what's best for our community and for those patients that we serve.
Now that facility is relatively new in terms of the history of the hospital, isn't it?
Yes.
When did that happen?
Point Base? Mm-hmm. What was that, Rod? 2098?
It was the early 2000s.
Yeah, it was early 2000s.
Yeah.
Yeah, so it's been a while. And then, of course, Apple Kids
Yeah, Apple Kids.
was one of the early off-site services.
Correct.
And the hospital also has a relationship with home health, which is off-site.
Yeah.
So despite the fact of all the growth that's happened at the hospital, fess up, many years ago, I spent a year and a half or so working at the hospital, and that was before any of the new construction had occurred. It was just those two corridors and a waiting room. That's important, that the hospital has grown enough that it's been necessary to do some off-site kinds of services. And then, of course, there's Bloomsdale. Who can talk to us mostly about what's going on in Bloomsdale? Which of you would like to take that on?
I don't think Jennifer has talked.
No, she hasn't.
She's hiding back there.
Charlie can see you and everybody else can too.
The Bloomsdale Medical Center is a 2-story building, and a lot of people think that each level is just one independent clinic, but it's actually several clinics contained in one. We offer services such as our Bloomsdale walk-in, so you can get care when you need it 7 days a week. It's open on the weekends from 8 to 1. We have the retail pharmacy out in Bloomsdale as well, that those hours correlate with the walk-in. So if you become sick at 6 o'clock, you can go to the walk-in in the evening and still get your medication filled and go return back home. We also have a couple of internal medicine primary care provider clinics as well in that building, in addition to our women's wellness, our Matee Breast Center, in addition to radiology and lab work that you can get done out there. If you were a patient passing by and needed to stop in and get your monthly labs done, you could stop in at Bloomsdale and get those services taken care of. So it's a complimentary, full service center right there in Bloomsdale.
How long has it been around?
2010. I think.
10, yeah.
2010.
Yeah.
So just about the history you described, years ago, walking into the hospital and just basically the two corridors. You probably remember those, that when you first walk in, there was this old rock wall with the
Yes.
registration desk.
Yeah.
There to the left was the little gift shop. I
Yes.
told this story with the auxiliary. I was just a little boy at the time, and my father, we came to St. Genevieve Hospital. We drove about 50 miles to come here. And I remember coming in, and one of the first people that met me as I came through the doors was one of the auxiliarians. And there was nothing better than that little bowl of candy they had sitting. But since then, though, in 2008, we opened up the new ER. We built on the new ER. So many probably remember the old ER, which was
Yes.
pretty much like two little bays with the curtain separating you now. What is there, 6?
There's the 8 exam rooms and the triage room as well.
So 6 of those are regular, and then 2 are actually trauma rooms. So if there's something that happens to come to the ER, patients can get good quality care to be able to get stabilized and get what they need. And then in 2020, we opened up the Pine Drive Medical Office Building, which is the medical surgical unit upstairs, and then in the basement, or the main floor, is several provider clinics in there, including urology, cardiology, and then internal medicine and several primary care providers.
And I like the fact that there are a lot of nurse practitioners. I think, I don't know if I should say this or not, but I think they take more time with the patient than a doctor does and talk to you more.
I agree with that, but that's okay.
You would have to.
You're committed, But some doctors do, like, particularly the old doctors, Dr. Loquetti and Dr. Genevieve, they used to sit and talk to you, but I guess they're so busy now, they don't really have time to do that.
Well,
Yeah.
they give all the time they need.
You know, and to the point you just made, what's different today with physicians and nurse practitioners that was not necessarily the case 20 years ago. And it's the regulatory requirements and the documentation requirements that are now required by not just the government CMS, but by insurance companies.
Right.
So I was having this conversation with a family practice physician. This has probably been 8 or 9 years ago now, and in a different community, different hospital. His name's Hank. And I said, Hank, help me understand how at one point in time you could see 40 or more patients a day. And now, there's days where sometimes you struggle even with 15. He said, Steve, the days, I already knew the answer. But he said, the days years ago when I could see that many patients, you would come in, I would look at you, you would have an ear infection, and I could write a note that said, I saw Steve Henson today, and I prescribed this medication for him, told him if he's not better in a few days, come back and see me. He said, now, for you to come in today with that exact same problem, after you leave, I will spend 15 to 20 minutes documenting for insurance companies and for regulations what I just told you.
Yeah.
And that's the
true.
biggest thing. So when you say older doctors, it's true from the aspect that it was they had a very different environment to practice in than,
Right, and
than any
they
doctors
probably
do.
had the office to do the recording also.
Well, there wasn't as much reporting that they had to do.
Right.
That's really the biggest thing between 20 years ago and today.
Yeah.
It's just the amount of paperwork that's associated with you coming in as a patient.
It's a complex system.
Yes.
Yeah.
One of the things actually one of the things that brought my family to this community was the fact that the hospital had a number of osteopathic physicians at the time we moved here. And my father had been associated with the osteopathic hospital in St. Louis. He'd served on the board. And so he was looking for a town when we were looking for a place to live that had osteopaths. And there were quite a few of them. Were they important in terms of getting the hospital off the ground?
That's a question I can't answer because I wasn't here at the time.
Okay,
Yeah.
okay.
Well, they were, because obviously we had Dr. Martz and
Dr. Glick.
yes, and our CEO at the time worked in DO hospitals, so he was familiar with it. But they were, I guess you could say, a DO at that time. They were more, small town, family oriented doctors, so they fit in real well.
Yeah.
So,
They do.
yeah, I don't know, Steve, can you speak any more on?
When it
Future
comes
DOs or-
when it comes to the DOs, we still have quite a few DOs on staff.
Yes, you do.
Yes, we
Yeah,
do.
you do.
And nothing against the MDs at all, because we have a lot of great MDs too. But I have always gravitated towards the DOs as far as my personal primary care, simply because they don't just give me some medicine and help me in other ways. They say, you need to lose weight, Steve, so get busy.
But we will add that
Not that I follow their advice all the time.
MDs aren't all like that.
They are not. There are great MDs, and
Yes.
we've got a really great medical staff. So you were saying earlier that you preferred advanced practice nurses, and I've had advanced practice nurses as my primary care too, in prior to coming here. But really, we have a really great medical staff. It doesn't matter if you're looking for an MD or a DO or an advanced practice nurse or a physician's assistant.
And a nurse practitioner is really under a doctor anyway.
Right.
They have a collaborative practice agreement,
Right.
is what that's called. So they are working independently. So a nurse practitioner could see you independently, but that doctor is still providing some quality oversight.
Right.
Yes.
I wanted to ask, or to say, I guess, that we have some very prominent physicians who have reputations throughout the state. And I'm thinking of Dr. Cavens, frankly, who is extraordinarily well known for what she does. And I think that it speaks well for our hospital that we have been able to attract people who aren't just known as great doctors here, or maybe in Festus or down in Perryville. They're known as great doctors throughout the state of Missouri and over the state lines.
And beyond.
Yeah.
Yeah.
Yeah, she drew patients from Memphis, Tennessee, and
Right.
and all over.
Yeah.
And no, she didn't really want to know that she was a general practitioner, a general surgeon.
Right.
She wanted to concentrate on more of developing the breast,
Yes.
the
Yeah,
cancer, right.
The teeth, I mean,
And that was great.
yeah, the great thing about that too is that you can go, as a woman, you could go in there and get everything done on the same day.
Right.
You get your mammogram, you can get your bone density, you can get your OB-GYN, exam, and it's great. I mean, there's
Yeah,
not
it
many
is.
places that you're able to get everything done on the same
Right.
day, and it's a great place.
Absolutely.
And then we have a new breast surgeon,
Dr.
Dr.
Ware.
Ware.
Right.
Yes,
Yeah, because Terry's practically,
Yes.
well, she is retired now.
How large is the medical staff at the hospital now?
I'm sorry.
How large is the medical staff at the hospital now? There are lots of pictures on the wall across from the waiting room, way more than when I was working there.
So again, as far as credentialed staff, the total's 193. Now, not all those pictures, not 193 pictures on the wall. You're right, there are a lot of pictures. So you won't necessarily see the pictures of all the radiologists that provide services
yeah.
for us, or some of these other physician specialties necessarily, but I can't tell you exactly how many pictures are on the wall. I can tell you the total number is 193.
Ballpark 30.
yeah,
Yeah. There's more than 30 pictures
There's
on the
more
wall.
I want to tell Charlie something. Charlie, put the number up on the television, so if anybody wants to call in and ask a question, they can call. So if anybody out there has a question you'd like to get answered, now's the time to call.
Sure, that's you.
Okay. Yeah. So what was the conversation?
I was fixed calling in with a question.
I'm interested in whether or not there are going to be any additional physical additions to the hospital campus. Do you have any plans for adding something in the future?
So,
Some of you are kind of nodding, and
Yeah, so are
some of
there-
you are looking like you want to avoid that question.
I'll take it on.
Okay.
So are there immediate plans for any other expansion? Not immediately, no. Now, I will tell you, I am already having some initial conversations about once we get the hospital on the footing it needs to be on, probably 2 years down the road, I would look at us having a complete revamp of our surgical suites and our surgical center. Again, as I started speaking earlier, I think we have a lot of opportunity, even though we already have a lot of specialists that are coming through providing services at our facility. I think we have a lot of opportunity for growth there through outpatient surgery. So, the hospital was built originally in 1969. We've talked about that. And while there has been upgrades and improvements and expansions, I would like to see us really bring our surgery center up to that next level. So I would anticipate that being something that you can see out there in the not too distant future.
Yeah. Is staffing an issue? Because we're 60 miles from everywhere, and the interstate is not fun to drive on, and housing has become a serious issue in this community, which the city is going to try and solve with their new project, but it's not. No ground's been broken yet. Let's just put it that way.
I think Jennifer, go ahead, Steve.
So Jennifer, answer this question and then I'll weigh in.
Okay. So our staffing challenges are not unique to any organization. The areas where we do struggle are the same areas that other organizations struggle in. Right now, primarily, it's, diagnostic imaging with nuclear medicine. Of course, nurses are always going to be in demand. However, we do not have very many openings. If you go out to our website to see, we have the same set of challenges that every organization faces. But I will say the people that we do have there are extremely skilled. Not only our medical staff, but our other clinicians, from our nurses to our respiratory therapists to our MAs and our OR staff. We have very qualified clinicians in our organization.
If I can tag on to that, just before Steve speaks. So Jennifer mentioned, like, in diagnostic imaging, for example, there's only a finite number of some disciplines in the state of Missouri, meaning there's only a finite number of certain people with that level of competencies. And like, for example, I heard a story just recently where there was an individual going to one of the colleges up in St. Louis for nuclear medicine. And I think there were 6 students in that particular class. So if there's only 6 students in the class, if you do the math, that's only 6 students to be able to coming back out to healthcare organizations, whether you're in St. Louis or you're in Cape Girardeau, if you're here in St. Genevieve, to be able to provide that core competency for that particular discipline. But I agree with Jennifer that we don't have any struggles greater than other areas.
I agree with that as well. And let me take that a step further, that when it comes to the quality of our staff. So if you look at other rural critical access hospitals across this nation, and you say, well, how many of those critical access hospitals are doing things like total knee replacements or hip replacements or shoulders? You find the answer is very few. We're doing that. If you look at across the nation at critical access rural hospitals that have cancer programs, I'm going to tell you right now, you're probably going to find one in the nation right here in St. Genevieve. So when it comes to what our capabilities are, we punch above our weight, so to speak.
Yeah, that's very good to hear, isn't it?
Yeah. And we're going to do more in the future.
What else about the future? What else is going to happen?
So the biggest things about the future is, and the Missouri Hospital Association is monitoring this for all the hospitals in Missouri. But what is the one big beautiful bill act, so to speak, what is that going to do with something like the 340B program, which is a drug program through the federal government that allows hospitals to have, in some circumstances, some cost savings to acquire drugs for patients that meet the criteria and pass that on to the patients. There's some questions about what the future of that program is. And then when it also comes to Medicaid in general, what is going to happen with the Medicaid program? There are some concerns that it's going to have a detrimental impact to a lot of hospitals across this nation, a lot of hospitals across this state. Now, we will have for the most part, a more minimum impact when it comes to Medicaid because we actually don't have that big of a Medicaid exposure as far as our payer mix. So a hospital's payer mix simply says, if you ever hear somebody say, well, what's your payer mix? What percentage of your payers are Medicare or Medicaid or commercial insurance, self-pay, et cetera, et cetera. A lot of hospitals have self or Medicaid exposures of 15, 20 plus percent. Ours is really much closer to 10%. For the hospital overall. Now, if you get into a certain area of the hospital, that number grows to be about 22 or 23%, but it's only in one department. The hospital overall, our exposure is really low. So will Medicaid, will we feel a sting if there are some negative changes to it? Yes. But will we feel a blow? The answer is no, not here locally.
So it's not going to put our hospital out of business or force a closing the way it appears to be going to have that effect in some communities.
So let me answer this question first and very clearly. There's not anything that's going to put our hospital out of business. So let me start there. When it comes to Medicaid, to your point, though, some hospitals struggling with it. Hospitals across this nation, especially rural hospitals across this nation have been struggling for years. So, one of the things the community, and when I'm talking about the community here, I'm talking about the nation, not just our local community. One of the things the community really doesn't understand about healthcare, you think, I go to the hospital and I got a hospital bill and, oh my goodness, did you see how much this bill was? Hospital do not get paid for the most part what the bill is. And in fact, when you look at Medicare and Medicaid, they don't cover our costs. So what I just told you there is if you come to the hospital and you have Medicare and it cost us $100 to provide you that service, our actual cost with the staffing, salary, wages, and benefits, whatever supplies we used, then in absolute best case scenario, Medicare is going to pay us about 98%. And oh, by the way, the absolute best case scenario almost never happens.
Okay.
Really, what we're getting paid is somewhere less than 50%. Medicaid is not quite that generous. And so, when you talk about, well, all the people on Medicare, the people on Medicaid, even before what may be coming out of Washington, it's already difficult for hospitals, and it has been for many, many years, to make the ends meet. That's why when you hear hospitals are struggling or hospitals are closing, that's just a piece of it that I was just talking about. Now, going back to your original question, there's not anything that's going to cause our hospital to close.
All right. I do have a question about what you were saying about costs rising. We're getting older as a population.
I thought you were talking about me.
No, we're the two of us are old enough that we cover it for everybody.
Okay.
As the population ages, there is kind of a presumption that we're healthier, perhaps, than the people who were 2 generations back are. But I don't know that that's true, number one. And number two, the medical field is so much more sophisticated and so much more can be done to help older adults. And is there any way a hospital can prepare for that kind of just sort of worldwide change?
So we are preparing for it every day through technology. As technology advances and we are able to advance with it, are we ever, as a small rural hospital, are we ever going to have some of the technology that you might find in a really big city? No, not if you go to a New York or a Los Angeles or a Chicago.
The Mayo Clinic.
Yeah, there you go. Yeah. But are there technological components that we can and do have that will help? And the answer is absolutely yes. You know, if you were to talk about diagnostic imaging and mammography, what it is today versus what it was 10 or 20 or 30 years ago, then just the advancements there are much more sophisticated, much more in tune with being able to catch a potential disease process earlier. So, you know, there are a lot of things as far as technology-wise goes. Also, just the education of the physicians today versus the physicians of 30 years ago. And don't get me wrong, I know a lot of physicians that have been practicing for 30 years that I have on our medical staff now and that I would love to have on our medical staff. But just as knowledge advances through the years, you know, our older physicians keep up with it through continuing education, and they, through continuing education over the years, have the same knowledge base that the physicians coming out of school today have. Now, what the older physicians have is 30 years of experience,
Yeah.
which counts for a lot. By the
Oh,
way.
yes. Yeah. Yeah.
Steve, can you talk about the technology? When you interviewed, we were walking around the hospital and he walked into our diagnostic imaging and he looked around and he goes, "My God, you guys have got some great equipment." I know most people think that, well, I'm at a small hospital. You don't have the technology that, Mercy has or our technology is right there with them. Can you talk about that?
I can. So when I came for my interview, and Herschel and Rod were taking me on a tour, we went all over the hospital, and I had already noticed everywhere that the equipment that the staff had to work with was really, when I say modern, was really cutting edge modern. And we got into diagnostic imaging. And when you get into diagnostic imaging, you start seeing a lot of really high-end and very expensive equipment. I mean, an MRI machine, you even start talking about an MRI machine and you're going to start talking in the low $1 million+ range, and it just goes up from there. But I was just blown away when I saw the nuclear medicine capabilities and the mammography equipment and the CT and the MRI. I mean, really, it was state of the art, and I did not see any equipment. Unlike other hospitals you go in, you might see a piece of new equipment, but then you may see equipment that has seen better days 10 years ago, and that doesn't exist with us.
How did we manage that?
I think over the years, I would credit, well, part of that's the board, as leadership recognizes that, hey, we need to start thinking about the end of life for a piece of equipment and being proactive and thinking that through. That way we can make preparations for that piece of equipment coming out through the budgeting process. And ultimately, how the process works, leadership identifies that, and then we bring it to the board for final approval. So just as an example of that, just in the past, 3 months, we replaced the laparoscopic surgical equipment in the OR.
Whatever that is.
So, basically, laparoscopic has 3 little bitty slits in the belly where the doctor is able to go in and do a laparoscopic procedure versus a big, long cut in the belly, as an example. That's kind of simplistic. But ultimately, that type of technology, I mean, that's what we can do very, very well and do those types of surgeries very, very well. And we have very skilled physicians that can do those. So put that piece of equipment in the hands of a very skilled physician, you get good outcomes.
Right.
So
Good outcomes are something that this community relies on. It's a life or death situation for us, and I think that's one of the reasons this community has been so supportive of the hospital, is that you have had good outcomes in a lot of cases.
I think if you look at our post-surgical procedure outcomes, and you look at what the complication rates are or the infection rates, you hear in the news periodically, somebody had a surgery, and not a local news, but somebody had a surgery.
And they left a baseball.
Yeah, or there was an infection. Yeah. If you look at our outcomes and you compare them with anybody around us, anybody, you will find that we hold our own with anybody, and we're better than most with our outcomes. So you just look at, I'll give you an example, look at our knee replacements. And you say, well, what percentage of our patients with knee replacements have complications downstream versus what percentage of knee replacement patients in some other hospitals have complications? And you'll find we do better.
We will take your word for that.
And well, to that point, we participate as a hospital, we participate with several federal programs. Like, for example, we report data to CDC. We report information and data to the Medicare Beneficiary Quality Improvement Program, basically reporting data to CMS. And then that goes to a website called Hospital Compare, and you can compare hospitals. And you're going to see exactly what Steve just said, that we're comparable, if not better, than many entities, even in this surrounding area right here across the United States.
That's great.
I think that ties back to, as Steve alluded to, our medical staff doing the continuing education, and then the clinicians staying up to date on what the best practice guidelines are, that not just St. Genevieve does, but, every organization following best practice guidelines. And also stemming from our medical staff, several of them have certifications in lifestyle medicine. Our primary care providers are focused on wellness visits. You don't just go to the doctor when you're sick. You need to go every year and have your preventative screenings to prevent issues that may happen down the road. And then when things do happen down the road, I don't think a lot of people do realize we have an oncology and infusion center. What we do here is the same exact stuff that they do in St. Louis or in Cape Girardeau. It is the same chemotherapy guidelines that they follow at Siteman. We use those same exact guidelines. The only thing that we can't do is radiation. But if somebody does have a need for chemotherapy or other rheumatology infusions or bone health is impacted, they come to that center and they get the very most up-to-date treatments for their conditions.
And I think that's something with healthcare. Healthcare is always evolving and it's always advancing. And much of that emphasis and focus over the past several years has been on preventative medicine. It has been preventative, going to see Dr. Charlotte to get a colonoscopy. It's going to see Dr. Ware to get a mammogram. And that's one of those questions you ask is like, how can we prepare? Well, that's not just for an aging population, but that's for 30, 40, 50-year-old as well. Preparing for their future and getting those screening exams, those wellness exams. That way you can catch things before they become too problematic. But know that if it does come problematic, to Jennifer's point, you get a cancer diagnosis, we can hold that patient's hand through that entire process.
Right.
I just wanted to mention, you talked about the community, and I just want to say the community of St. Genevieve has been wonderful for the hospital. I mean, if we come up and say we need something, a fundraiser for anything, that's why we have the cancer center that we have, is because of the community. So the community is very important and very supportive, and we appreciate that.
I was going to ask you, because you came here as a newbie, you and your husband.
35 years ago.
And you've stayed.
Yes.
And I think the community is very fortunate. Your husband is a very talented doctor, and we all love you. But in addition to the hospital being a good hospital, the community itself had to play a role in that. And it's one of the reasons that we do retain physicians, the fact that the community sort of likes doctors.
Oh, yeah. I think that's a part of it. And I think it's just it was very welcoming for us. I mean, we didn't come here thinking that we were going to stay 35 years, but we've been here 35 years. I just feel like I'm at home. I can go into Country Mart and spend an hour just talking to people in Country Mart. I don't like to cook, so I don't know. Maybe I go to talk to people.
That's how this particular session started. We met on the parking lot and started talking. So, yeah.
St. Genevieve has been very welcoming for us, and it's home to us. We don't know any other home. We don't have any intentions of being anyplace else. So, and that's it. I mean, I can't say enough about it. We have been here for 35 years, and it feels like we've been here forever. So I would tell anybody, come to St. Genevieve. And I do that when we have physicians coming in. I tell them it's a great place to live, a great place for children. And no issues for us. This is home. You're stuck with us.
And we're happy about it. Iris, anything else?
Well, I think they've covered everything. I wish people would call in. They ask questions and then, come on, you guys, if you got questions, the phone number's on
Now's the
the
time.
Probably talk to
screen.
Mid-Country Light.
You probably already told them all about it.
And listen, if you have a group of people contacting you, say, look, we would really like to have a conversation. I'll arrange to meet them down at the coffee shop early one morning, and we'll just sit down at a table
Okay.
and drink coffee, and we'll talk shop.
It sounds like a
Okay,
good
that
plan.
sounds
That's
like
an
a good one.
extension,
Yeah.
that's an offer I extend to you.
And that's a great place to go.
That's what I hear.
Common ground.
There
Yep.
you go.
Yeah,
Those
Yeah.
those little ones, well, they're not little ones, but I call them little ones. They are
do a
super great.
Take care of them.
They
do a great
they know everybody's name.
Yep.
They know what you want when you walk in the door.
You start making your drink. as soon
They
as you
do.
walk in.
And then I'll say, no, I don't want that today.
for people who might not know about Common Grounds, the kind of innovation that must have propelled people into deciding in this dinky little community at that time that you ought to have a hospital here, we want a hospital here, is the same kind of thing that was the inspiration, I think, for Common Grounds. It was not a government entity that came in and said, you need a hospital. It was individuals in the community who said, there's a need here.
Yeah.
We're going to figure out a way to take care of it. And I think the fact that that's sort of a theme in St. Genevieve is one of the things that makes many of our entities successful. And Lord knows you guys certainly have been.
Well, Gene, real quick,
Yeah.
several years ago, we were talking about the Bloomsdale Clinic.
Yes.
Okay. The board looked at, we need to grow. Okay. And we were concerned about the footprint of where we are. Do we have enough room? Is this where we want to be? And so we went out to the community and we said, okay, to the business leaders, what do you think? If we would move out of St. Genevieve and build a hospital, let's say on the interstate, okay, what would you think? And 9 out of 10, or probably 10 out of 10 said, don't do it. You will kill this community because we are one of the larger employers in St. Genevieve.
Yes.
And, they rely on the hospital as well as we rely on them. So we decided to go ahead and build the med-surg, we had room for that. And then we did the Bloomsdale Medical Center.
Yeah.
And that has been tremendous.
That's a
because
fabulous place to
We're
go.
pulling patients
Women's
from
wellness.
many different counties to the Bloomsdale Clinic. So I think that move was really strategic.
Now, what about the community center out there? Do you know anything about that? Is it just a walking trail now? Does anybody know?
I'm not
I
aware.
don't know either.
You have mentioned several times women's wellness. I want to talk about that for just a minute. We talked about Dr. Cavens earlier. So Dr. Cavens is actually going to be retiring coming up in really just a few weeks.
And she's going to paint.
Yes, she is. Yes, she is. And I think she's very good at it.
Chat with her doggies.
The only opportunity I've had to sit down one-on-one with her and have a conversation. She's obviously a very lovely woman and very talented. But I wanted to assure the community we are going to continue to focus our time, attention, and energy on the Women's Center. Dr. Caven was instrumental in bringing Dr. Ware in and helping get Dr. Ware up to speed, so to speak, in women's wellness and in the community. That is still going to be very much a focus of ours going forward into the future. And Dr. Cavens is doing a good job of passing the reins, so to speak. So the work that has been done here in that venue for years will continue into the future.
Excellent.
Yeah.
Because that's not true in all of the hospitals around us. That focus isn't as precise as it is here.
Yeah.
So.
There's a lot of things that are true about us that aren't true for a lot of hospitals around.
Right.
And some that we won't talk about.
I was talking about the good thing.
Okay.
Yeah.
I'm not sure. The new cafeteria is wonderful, but I sort of like the old days.
I kind of like the food.
Anytime
food
I've
is
ever
good.
been a patient out there, I had no complaints about the food.
We get a lot of comments, positive comments.
Yeah.
Excellent cooks.
Yeah.
Yeah. We thank you very much for coming. and giving us your time.
Thanks for having us.
Yeah.
It's always nice to have such a big group. And
It is.
a lot of laughs and everything.
You have to have fun.
Yes,
And,
exactly.
and I think that, what you all do, the institution itself, is so important in this community. And I don't know, St. Genevieve has not seen a lot of growth in the period of time I've been here, but it's been very stable. And I think the hospital is one of the major components of that. People don't feel like they have to move away if they've got a problem. People know that they can raise their children here, and if there's an issue, we've got great pediatricians. I think that you all play a role in keeping this community stable, that maybe isn't always recognized as part of what you do. Yes, you provide wonderful medical services, but it goes beyond that.
So let's talk about that for just a second, because you just hit on a great point. Pediatricians. So we have 3 pediatricians today. Two of them, all 3 of them great physicians, by the way. 2 of them have been practicing here for a very long time, 30 years.
Yes.
And while they're not looking at retirement, at some point in time, they will be. So we actually have, starting in just a few weeks, a new pediatrician who is coming in. Dr. Asaf is coming in. She is going to be able to work alongside some more seasoned, experienced pediatricians for the next several years. By the time that there is a transition there, the community will never see a voltage drop, so to speak,
Yeah.
because we're still going to have great, trained, and by then experienced pediatricians in the community for those children you were talking about.
Very good.
Yeah, so that's just part of the planning, and I can't take any credit for that. That's something that the board and the guys sitting behind me had a part of. They had the wherewithal to look and say, look, at a point in time, we're going to wind up with a pediatrician. Let's get another pediatrician coming in here so that we have, a plan to continue that service line.
Right.
Yeah.
And they've been here for a long time.
30,
30,
little over
yeah, I
30 years.
bet, because their little one
Yeah.
is really older.
Yeah. And they're not planning on retiring anytime soon, by the way. I was actually speaking with them earlier this week. But I was just sharing that as, the hospital talks about plans and acts on a continuation plan for things like this, just to make sure the community is.
That's
still
good
well served.
business.
Yeah.
I
Can
think
be
the other
good.
thing to
If you-
touch on is with the children in the community is our hospital engagement, reaching out to those kiddos. And so it starts with, we do elementary career days, just looking at the future of healthcare and recruitment, talking about different careers within healthcare. So we invite both schools to come and participate for a couple hours here in a couple of months, and then also shadowing experiences for high school kids. Them exploring what do they want to do. They can work in a hospital. You don't have to be clinical. We rely on our finance people and our IT people, in addition to all of our clinicians as well. So I think it's starting out young. Other initiatives that we have is like our back to school drive, supplying the kiddos with school supplies before school gets ready to start. So just reaching out to the individual, reaching out to the kids when they're young, so they're not scared to come to the hospital, and maybe one day they will want to be a future doctor or a future RT.
One of the most important things about the hospital is we're talking about outreach. I think if you live in a city, I came here from St. Louis. If you live in a city, you know your doctor. But if you have to go to the hospital, the chances are all those people are strangers. When you have to go to the hospital here, it could be your neighbor or your aunt or your cousin or your husband or wife. And I think that also is a strength of our hospital. It's very tied to the community itself.
I'd like to also mention the Friends Foundation that supports the hospital.
Yes.
They do a great job. And also our auxiliary.
Oh, yes.
Great women. I'm one of them, of course. They do a wonderful
They
job.
do. They do.
Bring that up. I'd have never live that down tomorrow.
If you would have said anything.
They do a great job, but we have to work.
Yeah, yeah.
We have a phenomenal auxiliary, truly.
At one time, I was the person who was the sort of the staff director for that auxiliary.
Yep, I remember that.
It was a long, long time ago.
I do want to share, Jennifer started talking a moment ago about outreach with the younger generations and trying to help them come along. It's not only us reaching out to them. So just earlier this week, Monday, I believe, Herschel, our local high school reached out to us and said, hey, we have a student that thinks that they want to pursue a career in sonography, ultrasound field, but they're not sure. They're wondering if they could somehow shadow at the hospital.
That's great.
And Herschel is working with them right now to get that set up and make it happen so that this high school student here locally can come spend some hours with our ultrasound technicians to really see firsthand what that field looks like. So that's an example of it. And we do reach out, but we also receive, and we try to find the way to work with anybody that's interested in a career in healthcare.
You know, I can think of several individuals within the organization that at some point in time, they may have come through as a high school kid, as a high school student, and now they're functioning as a nurse or as a CNA or maybe in the OR or radiology or lab, wherever. So I think that as much as anything, we really need to be able to grow internally, grow our own internally. Whenever we recognize talent in somebody that's going to be part of the organization and help them achieve their goals.
That interface, I think, between the hospital and the community, I think maybe one of the things that have both made you successful and made the town successful, that overlap of interests that you do not find in large cities. And so we hope you just keep doing what you're doing.
We're going to, and we're even going to do it better.
Jennifer, Herschel, can you talk about the radiology students and the nursing students from colleges that come here and shadow?
Yeah, I can speak
If
about
you
the
would.
radiology students.
Okay.
So right now we have a couple radiology students, one from down in Cape Girardeau, actually two from Cape Girardeau that are currently coming through the organization. And several of our radiology staff right now to that point have been students in the past that have come from other colleges. In fact, one of our existing staff, I recall she started up in high school and our radiology director was having conversations with her probably through one of those career days, and then she went off to college, kept in communication, and said, hey, whenever you get ready to graduate, I want you to give me a call. Let's see what the staff looks like there, or what our opportunities and needs are. And lo and behold, here she is now within the organization.
That's a small town story. That's great.
It is.
But that happens more often than what you think, though.
Yeah. Yeah.
And then in addition to, we have St. Louis College of Pharmacy that actively participates in clinical site rotations. And then we partner with Mineral Area College and Jefferson College for nursing students and respiratory therapy students to come on site and have clinicals. And oftentimes we're able to recruit them during their rotations to come work for us.
And that really is a pipeline just to keep that talent coming to us. That was speaks to one of those questions earlier. Staffing and staffing needs, and how do you ensure that you have the right people at the right place at the right time whenever the patient needs us.
And I think it's a lot of the students that are nurses and nurse practitioners, they've come from all over and put their name in. I know I have a granddaughter that's a nurse practitioner, and she wanted to do the pediatric shadowing here, and they had a waiting list so long that she wound up finding a place in St. Louis.
Actually, some of our nurse practitioners that we have on staff currently, they came through the organization as a med-surg nurse or in the clinic and went back to school, back to nursing school, and then ultimately they're here as a nurse practitioner. I remember one of them actually, Missy Nager, phenomenal nurse practitioner.
She's great.
So approachable.
She's mine.
Phenomenal. But I remember years ago, we had the privilege of hiring her, and she's progressed throughout the organization, and now you're seeing her as a provider.
Yeah.
Yeah, that's one thing we really pride ourselves in also is we have a model kind of grow your own. I mean, I was a housekeeper at the hospital when I was 16, and then I went, got into nursing school and was a CNA for a bit here in the hospital. But we grow our own internal employees, ones that want to go back to school. We look for a way to be able to send them back to school, and we work with their schedules to ensure that they can professionally develop into the career that they want to be in.
I'm watching the clock because we have two more guests.
And they have a
here
very
this
important
evening.
message.
They do.
And I just want to say, we can talk about the hospital all night.
I know,
but
I can
that-
tell.
That would not be kind of us. These ladies have a very important message that the community needs to hear as well.
You're the new guy and you get the last word.
Yeah.
You know, I'm sitting here listening to the conversation these last few minutes, and what comes to my mind is simply that we have a responsibility to the future. So we've been talking about that responsibility being helping people find their way into healthcare careers so that they can hopefully come to work in their hometown. But our responsibility to the future goes beyond that. We have a responsibility to the future to be good stewards of this organization, to ensure that, you know, we've been providing service since 1969, so that we provide service not just for the last 56 years, but for the next 56 years and beyond. And we are going to do that.
Good.
Thank you very much for coming.
Yes, ma'am.
Yeah.
We don't have a real neat and clean way of switching over. So you just kind of have to stand up and leave. Or we'd be happy to have you stay in the
The
audience.
camera, they won't see you leave.
We want to thank you.
Thank you.
Thank
for
you.
giving us the
Yeah. And
opportunity.
anytime you have anything to talk about, feel free to
Yes.
contact us, yeah?
I'm pretty
Or
sure.
meet at the coffee shop.
Move up here.
Okay, absolutely. Go have a coffee and, cool. Yeah, yeah, you too. Bye-bye. Yeah.
You too. Thanks, guys.
Thank you. Thank you all, yeah.
Should I sit here or should we sit across from you?
You can sit right up there.
Yeah. Yeah, because
He can pull you in on the camera well, yeah.
Goodness.
Okay, so now we're ready for, for our next guest. And Miss Kathy has been here several times. Thank you for coming back. And do you want to introduce yourself?
Yes, I'm Vernetta Melton. I'm president of the St. Genevieve Eagles Auxiliary,
Oh, well, good.
and we're very supportive of Kathy's domestic violence. Yeah, they helped me last year with
Well, great.
the rally. We're here promoting the rally.
Right, right.
Yeah, so getting myself.
Yeah, so Charlie can pull on either one of the
Yeah, I wanted to show
posters
off
he
my-
wants, yes.
my flyer. So we have the rally, it's my annual fundraiser, it's my second year of
Right.
doing the rally. And it's a People's Choice car show, which means people who come get to vote for their favorite vehicle. And even the kids get to vote, which
Oh,
is
how
exciting.
cool. Oh, yeah.
So
They'll love that.
Yeah.
Yeah, they'll love that. Yeah,
Where to put this? I'll put the budget on my wall.
yeah, he can probably pull that up.
Yeah. But I've got some.
It's the first time that's ever happened.
So, whenever you come to the rally, it'll be September 13th, and it's from 9 a.m. to 1 p.m. So we want if you bring a vehicle, we want all the vehicles parked by 9 a.m. But whenever you come as a visitor, you'll get a ticket. There'll be a table there. And whenever you get the ticket, you can walk around and look at all the vehicles. Each vehicle's going to have a number. It'll have a letter for the class that it's in, like we have Jeep class this year, which is new.
Oh,
We'll have-
really?
We'll have Chevy and Ford, the best truck. Let's see. Chevy, Ford, Mopar, and import class. There's a motorcycle class, rat rod, which if you're into vehicles, you know that that's kind of like a thrown together vehicle.
Right.
They look kind of rough. The rat rod class, the longest ride, which means the person who comes the furthest away. So the longest ride, and then the Jeep class is new. We have the prosecutor's choice, which is our county prosecutor, Wayne Williams. So he's going to go around, pick out his favorite vehicle. And the police chief's choice, which of course is Daniel Halleck is our police chief. And then we have a survivor's choice trophy, which is awesome because when you're a victim of domestic violence, you're often not given a voice because the abuser will not let them make choices or decisions on their own. So this is a way that they can make a choice. And so if you come to the rally, the leaders will have white scarves on. So, and then there's 3 of us that'll have hats, and we'll know more than everybody else. But if someone has a white scarf on, you can go to them and they have a ticket. It looks like the rest of them, but there's a little stamp on it. And with that ticket, you can vote for the Survivor's Choice Trophy. So just come up to somebody with a white scarf and they'll give you that specific ticket. It looks all the same. So anyway, that's a special trophy. Now I'll talk about our trophies. Weren't they cool last year?
Yes, they certainly were.
We've got them made this year, but I didn't give Charlie a picture. But they're made from real engine parts.
Oh,
Yeah, so they're welded.
clever.
Yeah, they're welded together and they're like a work of art, each one of them.
they're really cool.
They are a work of art if they're welding.
Yeah, they're welded together, and the person that welded them, he's Radical Randy. He's made motorcycles out of flat sheets of metal and sold them at Sturgis for like $60,000.
Wow.
He's really, really good with metal. But anyway, he's made these trophies for us last year, and he's made them again this year for us.
Wonderful.
And they're really, really cool looking. So we've got the rally Facebook page, and we also have an event. And if you go on there, the event takes you to the page. You can watch him make them.
Yeah.
And we made
Watch him making
Yeah,
them?
you can
Oh,
watch him
cool.
weld them and
Cool.
making them. And you can go back to last year and watch him make them from last year too. So we have video of him making them, which is really cool.
That is, I
They're
didn't
heavy.
know that. I bet.
Yeah,
So
they
what
fell over
parts
in the
do they
back.
kind of use? Like,
Engine parts.
oh, the engine parts.
Yeah. Camshafts, pistons, valves, the springs, just anything. We put last year, the motorcycle was on a 24-inch wrench, and it was kind of stretched out. It was really cool. And we had like 18, 20-inch tall ones.
Oh, my
The
goodness.
one on the flyer here is
really
a
different.
camshaft with gears, and they'll be broken. Like some of the pistons will be broken, scratched up and stuff, but that makes it kind of cool.
Oh, yeah.
It looks like a hookah.
Yeah, it does.
Yeah,
It does, but it's a camshaft on a gear, and it's got a little wrench.
That's
So,
neat.
yeah, but anyway, they're fun. But anyway, with this year, we've added something really cool. We have the trolley's going to be there this year, the St. John trolley, and they've sponsored us, so they're doing real good with supporting domestic violence. And what's cool
He's
with
got the last year's up on the,
Oh,
he had
okay.
them on there.
Okay.
Yeah.
So what's cool about the trolley is we're gonna do $5 fee for an adult, and then all the kids in the family that ride with an adult is $3. So if they have 1 kid or they have 16 kids, it's $3 for the kids.
Oh, okay.
So like if a
That's nice.
mom or
Has
dad
4
brings their
kids or whatever.
Yeah, mom and dad or a mom with all the kids would be $8, or a mom and dad with all the kids would be $13.
You haven't mentioned yet where this is.
That's
Oh, I'm
not-
sorry. It's at the River Rapids Water Park parking lot.
Right.
So we're also going to have emergency vehicles. So whenever you get there, there'll be, Sheriff Stolzer has given us the K-9 unit and the dare car, and we'll have, what else? The ambulance will be there, and we'll have fire trucks. The county fire said they're going to send 2 fire trucks. And then St. John Towing's going to be there with a tow truck. So we'll have all of that. And then Luna Ice, St. John Towing has sponsored 50 free Luna Ices. So those will be given out. And then K&J Landscaping has donated again this year a free children's raffle. So after the kids go around and pick out their favorite vehicle, they'll vote for it, and then they'll get a sticker that says they voted, and then we'll give them another little ticket. There's tickets everywhere. There'll be a poster there that explains it all. I'm trying to keep different tables with the different colored tickets this year. But they'll get a ticket, and they need to put their first name, their phone number, their sex, and their age on that ticket. And then we'll draw them. There's rules there where the tickets are, or where the prizes are. And we'll draw their ticket, and then we'll say who gets what prize. Because like last year, we had a basket of makeup for the 16-year-old, I think it was 13 to 16-year-olds. And then we have the little ones that I think it's birth to age 4 or something. And then they have little baby toys.
Yeah.
So you don't want a 16-year-old girl to get the baby toys.
Right,
So
right.
that's all the reason that we decide who gets it. We're just going to make sure everybody gets about the appropriate one, the
Right.
appropriate basket. So, but that's a free children's raffle. So they just have to, after they vote, they just put their name in there, and
Oh,
that's
Yeah.
that's sweet.
This is September 13th.
September 13th,
And what time does it start?
9 a.m.
9 a.m.
So now the trolley will run from 9 until 12:30. We're going to have it go downtown to where the French colonials having their,
Oh, that's great.
I can't say that, what it is. It's the French thing from the 1700s. They
Yeah.
can interact
Yeah.
with this, with the characters from the 1700s. And also Oktoberfest is going on, so they can go down there and just
Yeah.
visit. The whole thing at the rally, you can get in and out in about 2 hours' time. So they can go down there and visit, see what's going on, and go down there on their own later and stay if they want to. But it'll give them a little taste. The kids will be able to ride the trolley. It'll be fun.
Yeah.
Everything you've talked about is fun.
Yeah.
But the reason you're doing this.
Well, let me just hit one other thing.
Okay.
We're gonna have a boutique too, and the survivors have made bracelets that we'll be selling too. And then we've got
Good.
some trinket stuff for the kids
Yeah.
that they can buy.
That's cool.
But anyway, they've made bracelets. Yeah, domestic violence is not.
It's not fun.
No, no.
Talk a little bit about, is this a real big problem here or?
Domestic violence is a big problem in St. Genevieve. You can look at the numbers and see that it is an issue. Yeah. A lot of the people that I help don't actually go through the legal system, so you
Right.
don't see their numbers anyway. So the
Yeah.
numbers aren't really a big thing with me as far as the help that I give.
Right.
But I can help someone from questioning, is this abuse? You know, this is happening. Is it abuse? All the way to where they're out of the domestic violence situation, living on their own and wanting to date again, but not knowing if this is a good person or not.
Yeah.
So I can see them through the whole process. And I can help them with applications or, housing job. And I've kind of made a name where if I give a reference, I give an honest reference. I've known her for 6 weeks. They've done everything I've asked them to do, or they haven't done anything I've asked them to do. So I've kind of made a name a little bit for myself.
Yeah.
As far as giving references and on things like that. But I can help them. I'm not an attorney, but I can help them with like legal aid. And I have a lot of, I refer a lot. I do peer things with peer support, but I can also give them, I have a lot of contacts at the state level. I'm familiar with all the surrounding shelters and also the people that are in the offices and things of, like DFS and things like that.
Yeah.
So I have a lot of contacts, so I can give them like a person's name. You need to go to this office. Well, I don't ever tell them what to do either. I offer them
Yes.
ideas because they have to own their life. So they've been told what to do during their abusive relationship. So they have to, and they don't want to make a decision because they're not used to making decisions because they've been told what to do. So it's difficult for them to make a choice. But I offer them options and they have to decide what they want for their life now. Because they can never go back and say, well, Kathy told me to do this. No, I've never told anybody to do anything. They have to make the choice. They have to make the phone call. They have to make the moves. I never do anything for my clients. Never. I give them options. They have to make the choices.
And what does it cost them?
Absolutely nothing.
Which is
No.
the point of the rally.
Yeah. And I do everything, of course, everything's free, but I'm always there when they call. And I might work with them really intensely and I might not hear from them for a week or a month or a year or 2 years. And then I might hear from them again. And I might work with them really good for a while and then I might not hear from them. I've been doing this for 8 years. So I might not hear from them for 5 years and then they might call back. And I still talk to my first girl, which I love saying, but I still talk to a lot of them call back. But they're making their way and it's hard to get free and stay free of violence.
There used to be a pretty strong relationship between the state services, family services kind of things, and the people here in St. Genevieve. But we don't really even have an active office here anymore, I don't think, do we?
I don't know what you mean
A
by
family
state.
services
Like
office?
There
DFS,
is
you
one.
mean?
There is one?
Oh, yeah, we
Yeah,
have
like DFS? And do they do still home visits and things like that?
Well, DFS is different than what
Yeah.
I do. I mean, that would be
Yes.
like if you would hotline somebody or if they would check on the kids and stuff. Is that what you're talking about?
I'm talking about the fact that what you do is wonderful, but sometimes a client
also would need support from an agency like the Department of Family Services.
Like help with insurance.
Like help with
or
insurance
finances
and,
or
yes, that
No,
kind of thing.
What I would do
food
is,
stamps.
yeah, that comes all the
thing.
time. What I do is whenever they contact me and they need all of that stuff,
Then you,
first of all, I find out what their needs are. When
Yes.
someone contacts me, I make sure they're safe, number one. So if safety means being where they're at now, or if they need a shelter, or if they need to temporary, like get them to a hotel or something like that. So safety comes first, and that's constant. Every time I talk to them, I make sure that they're safe. Do they need to go somewhere else to be safe? Safety is always, it's a fluid thing. It's always being assessed. And then when they are safe, what do you need next? Do they have the insurance? Do they have that set up? If not, then right away, I've got a lot of information in my phone, and I shoot them that information. It has the numbers, the phone numbers, if they need to apply through email or through online, all that information I give them right away. And like legal aid, you have to do it through the internet, and food stamps and stuff you have to do through the internet. But I have those, and I send it to them where they can apply through their phone. But all that, I've got all those bases covered.
It's like doing it in a 10-step basis. You have to go to the main thing first, like you said, which is safety. Then you go to the next one, and I would think the next one will probably be food and shelter.
Yeah, St. Vincent de Paul has a wonderful setup.
Yes,
Yeah.
they're awesome.
They are very good. So if they're in an emergency situation and they do not want to go to a shelter, which it's hard to find a shelter bed, but if they do find a shelter bed, then transportation is our next obstacle, getting them to the shelter. But if they want to stay in St. Genevieve, but they need out of their emergency situation, then St. Vincent de Paul, I would give them their number, or I would get them from St. Vincent de Paul. And St. Vincent de Paul has a backpack set up. So they would get a backpack with food, and they would get a backpack with hygiene. And then I would go to where they're at in their hotel room, and I would talk with them, de-escalate them, find out what their needs are, with how they want to move forward. Do you need to set up these things? Do you need housing? Double check. Are you sure you don't want to?
do you have some family you can go to, that kind of question?
Yeah, we meet their immediate needs, and then long term, what are you going to do from there? There's the whole gamut of things. That's an emergency type situation. But sometimes I get it where they're still living with their abuser. And they want to plan on how they're going to leave. So that's another situation. And sometimes the plans don't work out, and then they end up in emergency. But, you take each person in their, I do very individualized. So each person's different, and they can change their plan at any given time. But I meet what they need, what they need, what is their priority. And then I offer them things, and then they choose what they want to do. But I give them the information.
If there's somebody out there watching who may be in that kind of situation, how do they get in touch with you? How do they find
I've
you?
got these business cards here. It's they can call. I've got a Gmail address, the same as like St. Vincent de Paul does.
Can we announce that?
Oh yeah, it's right.
Yeah, let's
So
do.
it's the number is 573. It's 880, and then 5540.
Let's say that again.
It's 573-880-5540. And it's a Gmail phone number, so you can leave any name you want. I do not care how you are. I'll treat you all the same. If they want to give their real name, that's fine too. But you can be anonymous, and you can just get information. I can answer your questions, talk to you as many times as you want without your real name. That's fine. There's one lady that never did give me her name. I wrote her down by the number of kids she had. But that's fine, because it doesn't matter who you are. I will give you the same information.
Yeah.
But if later you want to tell me who you are and we can work from there, that's fine too. It doesn't matter to me, and it's always confidential. I don't tell anybody anything, and then also I wanted to say that we do have a group in town where other survivors come to, and I'm up to 5 girls now. So, and I have been contacted by men who have asked me I don't have a group for men, but I have answered their questions and given them like referrals on state level stuff, like who they need to contact and who can help them. Because I'm only one person, but I can still make a huge impact.
Where can people find those cards?
oh, they're everywhere, but they can call the number or contact me, county health,
County
Just
Health has them.
There,
gosh,
you,
yes.
out of the country, Mark, you had some too, didn't
they're
you?
like everywhere. I hope they're
Okay.
everywhere.
Okay.
But county health, the hospital, the emergency room will have them. Just the city has them. Just like everywhere.
Okay.
I mean, the courthouse will have them. There's a poster that looks like this. I don't know if she can send her in. There's a poster that looks like this in town, and it's got a QR code on it, and the QR code has websites on it from like the sheriff's department, police department, the city, the hospitals on the website. There's a whole bunch of websites on it, and then there's some trainings that I did on YouTube that are on this. It's a digital business card. It'll be on your phone as like a contact, but you can change the title of the contact.
Yes.
If you want to hide that it's not domestic violence, you can change it to whatever name you want on it.
Aunt Fanny.
Yeah, and you can change that, but it'll give you all those websites right away,
Yeah.
where if you want to contact somebody, but it's got like the Missouri Coalition Against Domestic and Sexual Violence on there, and the other hotlines, like it's called the hotline, the National Domestic Violence Hotline. So anyway, these cards are around too. So
I think we'd like to think that we don't have that problem here, but we
the
do.
problem is everywhere.
Yes,
So,
it is.
I mean, it's everywhere,
Unfortunately.
and domestic violence doesn't respect anyone or anything. You can be educated, you can be uneducated, you can be rich, you can be poor, you can male, female. A third of our victims are male in St. Genevieve County, St. Genevieve City and County. That our numbers are real similar in the city and county as far as that's concerned. It's a problem everywhere. It's not just St. Genevieve.
And there's help.
Yeah, there is help. And I'm just a St. Genevieve connection. I understand St. Genevieve. I understand the people. You don't have to contact me. I'm just a local person. There's surrounding shelters. I can give you those numbers. I'm just a local contact that can put you in contact with other people. And I understand St. Genevieve.
Now, the last time you were on, you gave signs, talked about signs that people didn't even realize.
Red flags.
Red
of what
flags.
abuse is. Yeah. I don't know how much time I got. I'm trying to talk fast.
You got, you have 10 more minutes.
I have 10 more minutes. I can
Yeah,
relax
about 8
and talk
minutes.
a little quiet. Talk
Yeah,
slower.
about 8 more minutes.
Yeah.
I thought that was very interesting because it was so informative, where people that are hurting don't even realize that it's abuse.
So one of my newer clients that I was talking with, she was like agreeing with me. And when you start like in an abusive type relationship, you don't realize it's abusive. And one thing that happens is like, they might not like your necklace. Why'd you wear that necklace? Don't wear that necklace anymore. It doesn't look good.
Exactly.
And then, so you don't ever wear that necklace. And why'd you wear that shirt? And everybody thought that joke was stupid, so then you don't tell jokes anymore. And they just kind of take away. And you just feel like you can't even go out in public. And then they'll tell you, well, I sent you to the grocery store and you didn't buy steak. Why didn't you buy steak? Well, it's not on the list. Well, you should have known to buy steak. Well, then you've messed up at the store a few times, and then you're like, you can't even go grocery shopping. So then you don't grocery shop.
Tears down your
And it just
self-confidence.
it tears, yeah. And then before long, you're just like, you're trying to do homework with the kids, and you're trying to cook supper, and you're doing the laundry, and all this is going on, and the other person is like maybe watching TV or gaming or something, and you burn supper. And then they're like, well, you can't even cook supper. You burn supper. And it's like, yeah, I did burn supper. And so they treat you like you're no good. But you had all these other things going on, and anybody would have burned supper in that situation.
And
But they put you down, and you feel like and then you might get hit.
Yeah.
And it's like they might hit you, which is abuse.
But not all abuse involves a fist.
Correct.
A lot of it's
Domestic,
mental.
domestic Domestic abuse is the dismantling of someone's self-esteem that might require physical assault, is my definition of domestic violence.
That's a
So
good
there's
definition.
a lot of people are victims of domestic assault, domestic abuse, or domestic violence that never get physically assaulted. But
And
mentally and
actually,
psychologically are abused.
I would think the mental abuse in some cases is almost more traumatic
Then-
because you have no way, nobody sees it.
Right.
There's nothing there, there's no way to pinpoint it. And all of a sudden you find out this person's really down, what's going on?
Every
And that's-
victim I've ever talked to has always said emotional, psychological abuse, verbal abuse is worse than physical.
I think it would
And
be terrible.
if you get a bruise on your arm, you don't have to do anything. That bruise is going to go away on its own. But if somebody psychologically abuses you and you feel awful about yourself because they tell you you're an awful person, that does not go away. You have to seek therapy. You have to try to work to get that out of your mind. And some people can't, and even with therapy, it might be with you till the day you die. So it's a big thing. I mean,
It is, it's awful.
yeah. And sometimes you just can't, like I said, you can't get it out of your mind. So psychological abuse is real, and domestic violence is if you do something differently in your life because of fear of retaliation. Retaliation is violent. If it's physical or emotional, it's violent. That's domestic violence. If you fear retaliation and that motivates you to do something differently than living free, if you want to wear that necklace and you don't do it for fear of retaliation, if it's an argument or whatever, then that is domestic violence because you're fearing retaliation.
Yes, it is.
And then also you talked about how when they're abused, I'm sorry.
Yeah. Yeah.
So if you want to mention that a little bit more.
When you're insecure, you mean how it makes you insecure, or?
I think what you said was after someone abuses you, I'm sorry, I'll never do that again.
Person, will
Yeah.
respond always. I'm sorry.
Yeah.
I didn't mean to upset you or something like that.
Yeah, well, they take the responsibility for it. It's not their responsibility, but that's a common thing, is to say you're sorry. When you say you're sorry, you're taking on the responsibility of what happened when you're not responsible for it.
Right.
I'm not sure exactly what, there's actually a
No, I
paper
meant the
about it.
person,
The abuser.
that the abuser tells the person, I'm sorry.
Oh.
That
Yeah.
scenario, I thought that probably helped a lot of people.
Yeah, because so that they get forgiven, like they're not gonna do it again, because they are 100% responsible for what they do. And oftentimes they know what they're doing, and it's calculated, like they know they're gonna do it again, yeah.
We're running out of
So,
time.
okay.
We need to have
like
these
2
ladies back
minutes.
again.
We need to have like
That's
2
why I
minutes.
laughed, because I've already taken it down to the minute.
To the minute,
where I
hour
was
and a
like,
half,
You've got a minute and a half.
We need to have you all back
So
again.
you can go on.
After the rally, to report on the rally, maybe.
Yeah,
Come
you
back
can-
and we can talk.
Iris knows I'd come.
Yeah, you can go on and redo that.
Okay.
So,
Yeah, so the rally is a car show that supports domestic violence services in St. Genevieve. And it just gives me funding. Most of my funding just goes for printed material and education and stuff. So that's where most of my funding goes to. And I'm under the Community Services Forum umbrella, which is a 501c3. That's how I work underneath their umbrella. So it's September 13th from 9 a.m. to 1 p.m. We're going to give all
Till
our
3.
awards away at 1 p.m. at the River Rapids Water Park. And we have awesome prizes. We didn't even talk about our prizes. We have
hey,
great prizes.
24's up there.
Huh?
24's
No,
on
no,
the screen.
this is last year's rally.
Okay.
These flyers are this year's
Yeah,
rally.
Charlie, pull into this one. I'm sorry.
The small ones are this year's rally. The big one I brought to show how much fun we had last year.
Okay, because it came up 24 on the
Yeah,
screen.
yeah, no,
That's why I said 10 to 3, and then I said no.
No,
Then I saw-
last year's rally is the big poster, and that's how much
Right.
fun we had.
Now he's got this one up.
Yeah, this is the small ones are this year's rally.
So go through real quickly
It's
things that are going to happen. Yeah.
So we're going to have a free children's raffle. We have free Luna Ice. We're going to have emergency vehicles, and you can talk to St. Genevieve Heroes. They're going to be right there. We're going to have domestic violence survivor art. You'll be able to see local,
Artist. Oh,
yeah,
cool.
St. Genevieve artists that are domestic violence survivors. We're going to have a 50-50. We'll have a DJ. Aluna's going to be there with her braid bar. She's going to do braided hair like you've seen at the fair and at the Jour de
okay.
Fête. She's going to be doing hair. The trolley's going to be there. You'll be able to ride it downtown, see what's going on downtown, and come on back. And if you want to, you can go down there and stay longer. The Rally's gonna be over at 1 o'clock, so you can go down and see the Wiener Dog races at 2 o'clock. We're gonna give away our trophies to our winners, and we're gonna have prize drawings for registered vehicles. We have really awesome prizes. We have 6 River Rapids Water Park passes. We have a $50 gift card for the Hacienda Poza Mexican restaurant. And our grand prize goes for Doc Hendricks overnight stay with the suite. You get a suite down at Doc Hendricks.
Oh, my.
Yeah, for our grand prize. We're sponsored by the City of St. John. The St. John Trolley is sponsoring us. Classic Rock 93.1 and Ives Towing is sponsoring us. So we've got some wonderful
good.
sponsors.
Great.
So come on down, have fun. It's a kids activity, kids friendly. Gonna see some awesome vehicles, awesome trophies, great prizes.
At
lots of
the
stuff
water
to do
park.
At the water
Water
park.
park.
Yeah.
September 13th, listen to KSGM, Classic Rock 93.1. They'll be telling y'all about it too. We're gonna do sponsoring for 2 weeks before and the day of. So you
Great.
don't forget, listen to the radio station. You won't forget about us.
Right.
All right.
All right. Well, thank you, Kathy.
Thank you guys for having us.
You are welcome.
Thank you for
Thank you.
coming.
And
And
the
thank you.
Eagles were a big
Eagles.
support. They volunteered and helped me
Yeah.
out so much.
That's excellent.
great.
We
That's
had fun
great.
doing it.
Yeah,
It was a lot of fun.
Vernetta's girls helped me so much with the Eagles.
That's great. The
Now,
community worked together.
Oh, the whole community. Yeah, they weren't the only ones. Yeah, the women's club was there too, and
Yeah.
it was wonderful.
Yeah.
The volunteers were wonderful.
Yeah.
Yeah, I
Yeah.
think Margie's involved it. Margie.
Yeah, Margie Hogemiller,
Oh,
and
yeah.
we had some of the women's club were there
Yeah.
too. Yeah, yeah.
Yeah, that's where she's
Yeah,
from.
it was wonderful. The volunteers were wonderful. The whole day went really well last
It
year.
did. It
Everybody
really
had a
did,
really good
yeah.
time.
it's a very worthwhile project.
Oh, yeah, yeah.
Yeah.
Yeah, and the money goes to a really good cause. The girls really, mostly girls. I have helped men before, but
That's wonderful.
Yeah.
yeah, yeah.
Lots of work you put into things. Yeah.
Yeah.
So thank you for coming, and you come back anytime you want.
Yes. Yeah.
You're always interesting.
We need to let people know that if you've got something that's what's new, if you've got something that you have an idea that you'd like to have someone on the show, you can email us, and I'm going to read this fast. Lowercase SGCTV, uppercase WHATS, uppercase N, lowercase NEW, at gmail.com. And you can call us at 1-573-883-7675. We have the sign here. Maybe Charlie can move in on it and you can actually see it. But we're hoping to have a Facebook page soon, so it will be easy to find, and you can let us know if you have an idea about something you'd like to see on What's New.
We're going.
Sounds good.
Night, everybody.